To perform a calibration check of the iQ Spiro, you must first install the iQ Manager software. Please refer to Section 3 of the Operations Manual for complete installation instructions. Once the iQ Manager software has been installed, open the software by double-clicking on the iQ Manager icon on the desktop. In the opening software screen, click on the Spirometer Calibration button. This will take you to the Calibration Utility screen. Click on the Spirometer icon in the upper left corner to start calibration. The first time you calibrate your iQ Spiro, the following information needs to be entered in the appropriate boxes: the user performing the calibration, the syringe's serial number, which is located on the bottom of the syringe, and the iQ Spiro's serial number, which is located in the top of the device. Calibrating the iQ Spiro requires a 3-liter syringe. Midmark strongly recommends using the Midmark 3-liter syringe and included Midmark syringe adapter. The barometric pressure must be entered prior to the first time you calibrate the spirometer. To enter the barometric pressure, click on the Settings button and then click on the Calibration tab. If you don't know the barometric pressure, select Calculate Barometric Pressure from Altitude and enter the altitude. The software will automatically calculate and store the usual barometric pressure for that altitude. Now, click on the OK button. The iQ Spiro must be calibrated using an iQ Spiro disposable mouthpiece. To load a mouthpiece into the device, line the pins of the mouthpiece up with the ports of the spirometer and press the mouthpiece in place. Next, close and latch the spirometer door. To set up the spirometer for calibration, connect the USB or serial cable of the device into the computer and check to see that the green light is on, indicating the device has power. Attach the large end of the syringe adapter to the calibration syringe and the small end of the adapter to the disposable mouthpiece that is attached to the spirometer. Never calibrate the device with a syringe that fits inside the disposable mouthpiece. Always use the syringe adapter when calibrating the spirometer. Click New Cal on the calibration screen and click Start Cal. The sensor will zero itself and then the calibration pump screen appears. Pull the plunger all the way out and inject the air from the syringe into the spirometer. It is important to maintain a smooth, steady motion when performing the calibration. Use the red dotted line and/or the blue timer arrow as a target flow rate. After 3 correctly performed calibration checks, the system will automatically calculate a correction factor and prompt you to perform 1 verification pump. The spirometer will display a pass or fail message once the calibration procedure has been completed. The ATS recommends that the verified volume should be between 2.89 and 3.10, plus or minus 3.5%, to be accepted. Refer to the Operations Manual, Section 3, for further detailed instructions. The iQ Manager software contains a calibration log that retains all calibrations performed for the spirometer. To view and/or print the calibration log, go to the Calibration Utility screen and click on the View Calibration Log button. Before plugging the iQ Spiro into the computer, make sure that the iQ Manager software has been properly installed. Before testing patients, it is suggested that you check and change any desired settings. To customize the iQ Manager software, click on the Configuration button. Enter your institution name and address and other information in this screen, and then click on the Spirometer Settings button. At the top of this screen are 9 tabs. Click on each tab to find, enter, and/or change information in that field. If you click on the Interpretation tab, you can change the primary and secondary reference equations. NHANES is the most recent reference equation and is fully validated. We highly recommend its use for patients between the ages of 8 and 80. The Incentive tab allows you to pick the incentive you want on the screen during testing, and there are 5 incentives to choose from. For complete information on the data included in all of the spirometer settings tabs, refer to Section 3D of the Operations Manual. To perform an FVC test, click on the iQ Manager icon and then click on either the Patient List button or New Patient button. In this example, we will be setting up a new patient. It is essential that you correctly enter the patient name, ID if required, and the race, age, sex, and height of the patient, or what we refer to as the rash in this screen. Other information needs to be entered here, such as smoking history, medications, patient history, and risk factors. If the patient is a smoker and you have entered smoking history information, the test will display a lung age and COPD risk for the patient. This information is often useful for smoking cessation. Next, click on the New Test button. You will see that a new test screen appears. On the left of the screen, select the test type. On the right side of the screen, enter the data required and click on OK.